Absolutely. Well, when we first started doing this research about 25 years ago, our vision was to have a tool like a glucometer, like when people measure their blood glucose, to be able to tell us, what was going on in the brain, give us an idea. And so that was our vision when we started this 25 years ago. And here we are, 25 years later, and we have this point of care device that you put a couple of drops of blood on, and within 15 minutes you have a result. So it's great because that was the vision, and here we are. We have the vision, in clinical, real clinical time. So it's really been great. The official FDA approval for the test is in adults within 24 hours of injury in patients with a mild traumatic brain injury. And so that is the FDA approval for it. And so that is what we're doing in our emergency department. But of course, you can imagine this could be used for our military, right? To help servicemen and women who are injured and give us some idea of what's going on. Same thing, in organized sports, you could use it on the sidelines, right? To evaluate players that have been injured in an ambulance. So you have to triage a patient to go to a trauma center or not. So there's really so many applications for this test because it is so easy to use. 15-minute result and you have an answer. So I think it's going to expand beyond this. I mean, we have primary care, so we have physician's office, right? Patient comes in, with a possible TBI. You do the blood test and you determine whether you need to send them to the hospital or not to get a CAT scan. So the applications are enormous, and now beyond the FDA applications, the idea would be, well, can we diagnose concussion with it? That would be another great use for it, although that's not what it's approved for at this time. But we're hoping that could go there. In children, oh my God, it would be huge if we could use this in kids. And so we're currently conducting tests right now, or a study now in kids, to be able to use it in that population. We've done some research already in children, and it has showed us these two biomarkers are actually very good in determining whether children need a CT scan or not. And that's our preliminary research that shows that. And so hopefully we can validate that over the next couple of years. So that's another really exciting application. And helping to inform treatment, to decide, what kind of treatment a patient needs. It can even help us with research to help us determine new treatments and give us an idea of, if the treatments are working, and monitoring whether treatments are going in the right direction. So there's so many uses. It's almost endless at this point in time, but we're really excited because we feel that we're just getting started, that this is the game changer that's getting things started. Well, for children, they come in different developmental stages, right? Different ages are developing at different rates. And so we have to make sure that the biomarkers will work at different ages. And so we have to make sure that the cutoff levels are appropriate. So it's a little bit more challenging because we want to make sure we do it right and we're precise. We've done some work showing that in elderly patients that the biomarkers are a little bit higher than they would be in younger patients. So we know that we have to be very careful with age-specific cutoff points. These two particular biomarkers, the GFAP and the UCHL1, the GFAP actually comes from the astroglial cells, so the supporting cells of the brain, whereas the UCHL1 comes from the actual neuron. So it's interesting, it comes from two different cell types, and they're very complementary. So when we started looking at them, they were actually histologic markers. So, if you wanted to stain under the microscope astroglial cells, you would use GFAP as a stain. And if you were looking at neurons, you would stain UCHL1 to take a look at the neuron. So these were originally staining tools to help us identify different cells. And so now we've repurposed them and we've noticed that, when the brain gets jostled and there's damage, these proteins that are normally found in the cells spill out and they leak into the bloodstream. And that's where we detect them. And in really very, very small quantities, we're talking picograms. So it's interesting how these biomarkers started off as histologic markers, and now they're actually diagnostic markers. So it's been a very interesting, change over the years to repurpose them.